Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi, who is a famous gynecologist, obstetrician in Udupi, and she has been the past president of IMA Udupi. And apart from that, she has a great hobby of writing. Not only the column, she has written a book for the women to tell everything about their health and hygiene, how they have to maintain. More than that, she goes to the schools and colleges and visit the women's club to bring awareness among them, especially the teenagers. The healthy habits have to be inculcated, and she's been doing that regularly. Today, we are very happy to welcome you, madam. Welcome to our show.
Thank you, ma'am. Thank you so much for having me here.
Yeah,
Thank you for
it's
those
a
kind
pleasure.
words.
Yeah, it's a pleasure to have you. And women means, from the time they attain menarche to the menopause, the bleeding is part and parcel of her life. But when the bleeding is too much, it is really exhaustive. And that too, if she is passing clots, it can have like a dysmenorrhea, so much of pain during the bleeding. And then she can have anemia and she can be really tired at the end of the day. So, what are the causes for this, right from the menarche to the menopause? Please explain to us.
Yeah. Yes, ma'am. Every woman has a menstrual period every 28 to 35 days, and she bleeds for 3 to 5 days, and she
Yes.
loses around 50 to 80 milliliter of blood. So this is the normal blood loss for a lady. So if that
So
blood
the
loss is
every month losing 50 to 80 ml means it is like 6 to 7 beats of heart and that
heart,
much blood. So we hardly feel about it because it is a routine and the blood again regenerates and then nothing happens. But when the bleeding becomes more, then only it's a problem. Yes.
yeah, if that's what, if the days are more, if the bleeding is coming too frequently, if she
Hmm.
bleeds more, that in a sense she has to change her pads every 2 to 3 hours,
Hmm.
and the amount of blood loss is more, then we called it as heavy menstrual bleeding. Why we should
Okay.
bother about it is because it produces anemia. It can
Hmm.
dispose her to many infections, and she will
Okay.
lose her work. Her daily routine work will be problematic for her. She may not be able to
Yes.
conduct her duties. So we have to uh, diagnose what is wrong with her, why is she having excess bleeding, and give her treatment to her.
Okay.
Yeah.
Now, what are the causes in the when she attains the menarche, the teenager girls, what are the problems in the teenage and what are the problems when they are in the fertility or
Productive age group.
reproductive age, and what are the causes in the
Yeah.
old age after the
Yes, when we
menopause?
discuss about heavy menstrual bleeding, we have to discuss like this because same cause will not be there all through her life. So during her adolescent years, the periods will be irregular as such because the pituitary ovarian axis not yet mature. So because of that, she gets irregular period. When she bleeds once in 2 to 3 months, she might have extra bleeding. And then because of nutritional iron
Hmm.
deficiency, she might be having anemia that also can cause excess bleeding. And these are the physiologically
Yes.
they will have irregular period, but pathologically if they are overweight,
Hmm.
they have insulin
Hmm.
resistance, so they may be having
Hmm.
PCOD and PCOS. In that also they
Yes.
will
Yeah.
have irregular periods and they'll bleed more. So these are the causes.
Yes.
And these days the adolescent girls are sexually active, so even the
Hmm.
genital infections can lead to excessive bleeding. Rare,
Hmm.
but one of the causes is some coagulation abnormalities like purpuras, hemophilias, or some factor deficiencies. So these are the
Hmm.
common causes in adolescent age group. When we come to
Okay.
reproductive age group, the first one is improper use of contraceptive tablets and emergency contraceptives. They don't consult doctors; that they take it on their own
On
because they
their
are
own. Yeah. Hmm.
hormonal tablets. They have withdrawal bleeding, and that can be abnormal. And
Hmm.
even when they are having abortions, miscarriages, they can have
Hmm.
abnormal bleeding. Pelvic inflammatory disease, where there is infection in their uterus, in their tubal infection or cervical infection, that time also they can have excess bleeding. So when we move on above 30 years, the excess bleeding can be due to polyps, endometrial polyps. It can be due to adenomyosis. Adenomyosis is a condition where the uterus is bulky. It can be
Okay.
due to fibroids. It can be due to endometriosis. It can
Okay.
be due to malignancies.
Oh,
So when
I
we go
see.
on towards the perimenopausal and menopause and postmenopausal age group, we have to think more in terms of malignancies. If they
Or the
have heavy
cancers.
menstrual
Yeah,
bleeding,
cancers are
yeah,
more common.
cancers.
Yeah.
We have to think of cancers if they have heavy bleeding.
Hmm.
So the causes varies according to the based on their age groups.
Okay. Okay. Now, how do you make out what is the cause for the bleeding and how do you treat and what are the facilities available to test as well as to treat?
Okay. In adolescent age group, usually it will be the physiological heavy bleeding, but we should prevent anemia. So we should do a blood test to check a hemoglobin, and if a hemoglobin is less, that should be treated. Lifestyle changes to have we have to educate them to have a healthy lifestyle so that they don't go on to obesity and PCOD. Then, in case of the coagulation defects, the blood test itself will reveal. Then,
Okay.
any function, the functional or the structural abnormalities are there means the scanning facilities, ultrasound, CT scans, they will give us the clue.
Mhm.
Then, in case of perimenopausal, menopausal age group, we do endometrial biopsy. We take away the tissues from the endometrium and test it under microscope to rule out malignancies. We also do colposcopy. We also do pap smear to rule out the cervical causes. If there is some cause within the uterus, hysteroscopy can be used. When there is endometriosis severe, sometimes we may not be able to make out in the ultrasound also, even with the transvaginal ultrasound. Then we might need laparoscopy also. So all these various modalities help
And
us to
apart
diagnose
from the
the cause.
laparoscopic, you have the hysteroscopy and colposcopy also.
Yes, yes,
Yes.
yes. So laparoscopy views the uterus from the abdomen through the abdomen. Hysteroscopy, we view the uterus through the cervical
From within.
orifice.
Yeah.
Yeah, within. So
From
if
inside.
small
Yeah.
growth, yeah, some growth is there, polyp, or some small fibroid is there, we can diagnose also, we can remove it also vaginally from there. So it
Okay.
helps in both the things.
So it is for detection as well as for the treatment. This
Treatment.
colposcopy and hysteroscopy.
Yes,
Okay. Okay.
yes, yeah.
And
And
suppose, yeah.
this
Go ahead.
endometrial biopsy, previously we used to call it as DNC. It has to be
Yeah.
under sedation or under anesthesia. It was a procedure. Now we have what is called as office endometrial biopsy. It is just aspiration. We just put a thin catheter inside the uterus and we aspirate the uterine
Yeah. You
liquid and
suck
we
the
test
whole
it site.
liquid. Yeah.
Yeah,
Yeah.
yeah, that is endobiopsy, aspiration cytology we say. So it is easier. It is an office procedure. Even hysteroscopy is done in the OPDs as a office procedure. So it is easy to
Okay.
diagnose.
Okay.
Yes,
So
ma'am.
thank you very much, Dr. Rajalakshmi. You have explained so beautifully. Thank you very much.
Okay. Thank you, ma'am. Thank you so much.